The Gauteng Department of Health and the CEO of the state-of-the-art Nelson Mandela Children's Hospital signed a service-level agreement yesterday. According to the department, this is in a bid to support the Nelson Mandela Children's Hospital financially as well as operationally, because there were reports previously saying that the hospital has been struggling financially since its operation back in 2017. But I was speaking to the CEO now saying it hasn't been the case. Let's find out more about this issue now. We joined in our studios here by the MEC of Health in Gauteng, Dr. Gwen Ramokgopa, and Dr. Mandisa Maholwana, who is the CEO of the hospital. Good morning to you both. Thank you so much for coming through.
Good morning, Palisa.
All right, let's look at this. Thank you so much, MEC. Yes. Let's start by looking at this, the agreement that was signed. Yes. What does it entail?
Palisa, I just want to once more assure the public that the Nelson Mandela Children's Hospital is a state-of-the-art, and we actually refer to it as a state-aided hospital, meaning that whereas there were partners who helped us fundraise for the infrastructure, which is really state-of-the-art indeed and modern technology, for the operational costs, the government has made available 650 million rands over the 3 years. And we have already, as of the beginning of 1st of April, 2017, we had begun giving them the 150 million for this financial year. So it is not struggling with funding, and it has never struggled with funding. And we want to thank all the contributors before.
Dr. Maholwana,
the signing of the agreement.
Yeah. Okay. Okay, no, it's fine. You can go
The
ahead.
signing of the agreement yesterday, it was a service-level agreement which was between the accounting officer of health and the accounting officer, which is the CEO of the hospital. And it was also to set in the second phase of the admissions. The first phase was more on radiology services. The second phase is ICU, 40 additional beds, the nephrology, pediatric nephrology, and pediatric cardiology. There will be a third phase again. This is how it was planned, and the funding also is given in that way.
But Dr. Maholwana, the reports of the hospital being facing some financial difficulties, I think we reported on this as well last year, and we had you over the phone trying to explain this. Where are they coming from?
We're actually not clear, Palisa, where the report started from, but we did try to clarify to basically say that government had committed to providing the hospital with an operational budget, and they had done so. And as far as the phasing in of the hospital was concerned, we were all on track in terms of the amount of funding that was given to the hospital and the amount of services that were committed to be provided by the hospital in the first financial year. So on our side, we were very much on track, and we're also adequately funded for the first phase that we had committed to.
And everything is running up smoothly, no hitches, no nothing, because we also saw the official opening of the ICU sector yesterday.
Yes, yesterday we opened the ICU. It adds 40 additional beds for ICU in our platform of services. What was the concern is that we're moving slow towards admitting for the second phase. And I must explain that the reason was that we had not finalized the clinical governance. We must remember that when the hospital began, they didn't have doctors, they didn't have nurses to start operationalizing the other phases.
And apparently there were
including
also
the
reports,
referral system.
Yeah, apparently there were also reports saying that doctors do not want to join the hospital, fearing that the hospital will not have sufficient funds.
No, not at all.
But you do know about the reports, isn't it?
We are aware of the reports, Palisa, and that is also untrue. To date, we have managed to recruit doctors, medical specialists for all the services that we have to date, which is radiology, anesthesiology, cardiology, nephrology, and also the ICU complex, being both the pediatric ICU and also the neonatal ICU. And we've got high caliber doctors who have joined the hospital full-time to work in the hospital.
All right. Now, back to you, MEC. The Provincial Health Department will be responsible for the monitoring part of it.
Yes.
Okay. Talk to us
We're
about
treating the Nelson Mandela Children's Hospital like all other hospitals that we fund. We have an agreement with the hospital to provide quaternary services. These are based on referrals, not only from the VETS group of hospitals, but also as far as Tshwane hospitals, as well as actually throughout the country and the SADC regions. So we are indeed, we had to sign a service level agreement so that they are compliant with the Public Service Administration Act. the Public Finance Management Act, the National Health Act, and all the other relevant legislation. But I have no doubt the people on the board are people of integrity who are highly skilled, and I'm looking forward to really having an accountable and productive relationship with the hospital itself. I'm even taking the lessons from setting up an effective governance structure that will most likely also use for the rest of our public hospitals.
All right, and we've also had the Premier of Gauteng, David Makhura, earlier this week saying that he and the Minister of Health have also appointed an intervention team to sort of support you in turning around the performance of local health departments. So, there's still a long way for you to go in Gauteng, not just about the hospital itself, but in terms of the health services in general.
We've gone a long way to stabilize the Department of Health overall, but we still, because of the inherited problem was quite big, we think we will deal with the problem of accruals over the next 3 years. But the team is there. We have lost, since I joined the department, we have lost no less than 8 senior managers. I didn't want to just immediately appoint, and that is why I went to both the Minister and the Premier to say, can we put our heads together and have a high caliber team to help the transition. And indeed, we are busy also interviewing for the accounting officer, the heads of department. We've already appointed a young, dynamic chartered accountant as a chief finance officer. We've made appointments in the legal side of it. So we are bridging that gap of a number of officials leaving since. And we are also stabilizing the department. This is a very important asset for the country and also the continent. It's for service, for teaching, and also for research.
All right. I'm going to talk to you about the EFF marches that took place here at the Baragwanath Hospital in a short while. But I just want to bring you in the conversation, Dr. Maholwana. We know that the hospital depended entirely on donations. An amount of how much? 1 billion rand was put together for the building of the hospital. Where are those donors? Are there still people coming to the fore and donating?
Okay. So I think just to take you a step back, Balisa, in terms of how the hospital came about, as we all know that it was Tata Madiba's dream to build this hospital for children. And one of the founding principles was that he would go and raise funding from donors locally and internationally to be able to build the infrastructure, as MEC has said. And then government would come in on the operational side with the operational budget. So those donors committed specifically to the capital fundraising to put up the infrastructure of the hospital. And we continue to raise funds. There's different modalities of raising funding other than the capital structure that was initially being dealt with. Now we continue to do that to support specific activities in the hospital. There's various areas where donors have actually been quite happy to come in and look at proposals, look at how we can work together to fund, for example, cancer patients. So those are some of the projects that we're looking into going into the future. So donors ordinarily would have a very specific purpose for the donation that they give. And now we're looking at those specific let's say passions from people or areas where they want to contribute areas of value for pediatric health
All right.
care.
A quick one on this, MEC. EFF's march to Bara Hospital yesterday?
I must say that I'm very excited that it's not only the government, especially the health sector, that is saying health is important for our development. That investing in the health of our people is investing in a sustainable economy. So I really welcome the focus on health by the EFF, and I also would like to thank them that the march was also making very specific demands, and that they did not, as other people had
but do you agree with their concerns? Because their concerns really is that the state of the hospital is not up to scratch, and Julius Malema was specifically saying that Batwa Hulu don't even want to be admitted to that hospital. So what's the way forward?
Palisa, I must say that, for instance, the conceptualization and the design, including the sustainability of the Nelson Mandela Hospital, will be with the support of our specialists, world-class specialists that are at Bara, Charlotte Maxeke, and all other hospitals. The biggest problem with our hospitals is the infrastructure. We have made significant progress. Like, for instance, the Bara casualty is a new building in the new democracy. So we will be continuing to ensure that even all other dilapidated buildings, we make them world-class for our world-class specialists. But yes, on quality, we need to do more. To make sure that our people get the best quality care. I agree with them on their demands. Those are the demands that are in the Patients' Rights Charter that we all aspire to do. And we encourage communities and families and also patients to complain if they don't get the best that they're supposed to get.
All right, we have to leave it at that, MEC. That's, of course, a conversation for another day. We'll invite you back to the studio. Thank you so much for coming through. Thank you so much to Dr. Gwen Ramokgopa, Health MEC here in Gauteng, and Dr. Mandisa Maholwana, who is the CEO of the Nelson Mandela Children's Hospital. Let's take a quick break here on Morning Live. When we come back, we'll say our goodbyes. Don't go away.